Currently, the most frequently performed cosmetic procedure in the United States for women is breast augmentation. It's been that way for the last several years, and it doesn't seem to show any signs of changing anytime soon. Augmentation is not only a very popular operation, but it's a safe operation, and it's important to take everything into consideration when choosing the best procedure and the best implant for the patient. Fortunately, today we have a selection for patients regarding breast implants. Basic differences are saline versus silicone, and within those categories we have high-profile implants, we have moderate-profile implants, we have textured implants. Probably the most commonly used implant for women today is the smooth round silicone gel-filled implant, and that has changed since 2006. Between 1991 and 2006, silicone implants were not available, and now they are. And between 2006 and 2014, it has become the most popular implant. But not everybody is a great candidate or actually needs the silicone implant. The differences between the two, the silicone is has a softer feel. Most people feel it's a little bit more natural in its feel. As you can see, it has, when it sits like this, as it would in the body, there's some wrinkles on the implant. On the saline implant, same thing. It wrinkles too, but these wrinkles are a little crisper, they're a little sharper, and they're more likely to be felt if there's not enough tissue coverage over the implant. So when a patient comes in and tries to decide what type of implant to use, it's very important to take into consideration all of their characteristics. For example, if you have somebody that's very lean and doesn't have much breast tissue, this is probably the better implant because they're less likely to feel the ridges. Now, it would be wrong to think that a silicone implant does not have any wrinkles. It does. They're just softer and they're less likely to be felt than saline. I think in general, it's a good way to look at it would be that if in the end 1/2 or more of the breast volume is implant, then it'd probably be better to be thinking about a silicone implant. On the other hand, if there's enough breast tissue, native breast tissue to cover the implant, and in the end more than half the breast is actual breast tissue, then you can probably use a saline implant and not worry about the palpable edges. Those are the basic differences of silicone versus saline. Now there's one other important difference, is cost. A saline implant is less expensive than a silicone implant, sometimes at least 50 to 75% cheaper. And so for some people, they can get a good implant, one that will give them a good outcome at a lesser cost if they have some concerns about budget.